Hi all, my name is Steph. Welcome to this training session. This is a training session aimed at receptionists and administrators in a GP surgery. By now, your practice manager should have told you, would have told you that you do now have a patient-facing app. So, as administrators and receptionists in a GP surgery, you need to know what the app does offer patients. Really. So in a minute, I'm going to share my screen so you can see what the app's homepage looks like. We'll be going through then the main features of the app and how it can help your patients and you guys in reception. So a little bit about me, first of all. My name's Steph. I was a practice manager in a surgery in South Wales for 17 years and a cluster lead. Of a morning between 8 and 10, the mad rush, isn't it? I used to sit with a receptionist and answer phone calls myself to help get through the work volume. So I'm acutely aware of the amount of work the receptionists and administrators get through in a day, the type of phone calls, the call volumes, patient expectations are getting a lot bigger, aren't they? So the app has been built to give patients a choice of how they contact you for the services that you offer. So we're going to share a screen now, and you will be able to see the app's homepage. So this is on your, I think, left-hand side. You can see it. This here, it says Grange Road Surgery, which is part of Grange Road GP Cluster. So this is our test surgery. So when the patient downloads the app for your surgery, they will see your surgery name here, and then whichever cluster your GP practice is a part of at the moment. Now, if you scroll down, there's a lot of buttons on the homepage, which I'd like to go through with you. This is the main thing that you need to know about as receptionists and administrators. So when you do tell patients to download the app, you know what you're talking about. So the first button here is face-to-face appointment. So much the same as you guys have a control panel in reception where patients can arrive themselves for appointments. It's quite difficult during COVID when some patients couldn't come in or you had certain restrictions. So we built this button in the app where patients it functions exactly the same as the patient would if they're arriving themselves in reception, but they can do it now through the app. It's important to note that all of these buttons, your practice manager has a management portal, so they can disable or enable any of these buttons in the app. So if the practice manager or as a surgery, you didn't want to enable this, then your PM will go into their portal and just take the tick out of this functionality, and it disappears from the app's homepage then. But that functionality is available for patients. Next is a button for any clinical queries. So if a patient has a clinical query and you guys are using either eConsult or Ask My GP or Engage Health, one of the companies out there who are offering online triage, then the patient can click here and it says, send us an online query about a new or an ongoing symptom. So the patient clicks there, and that takes them then to your, this surgery is using eConsult, but if you're using Ask My GP or Engage Health with anybody else, then that takes the patient to your online triage portal. The next button then is online repeat prescription ordering. So patients, if they've got a My Health Online account already, they can just click here, order repeat medication, and then that takes them through then to the My Health Online portal if you're with EMIS or Vision. If they don't already have an account, then they can register for online services now through the app. So currently, patients have to come into surgery, they fill out the form, then they give you 2 forms of ID, and then you process them that way. They no longer need to come into surgery, so they can click the button here, and then they can say, okay, well, I want to be registered with My Health Online. They fill out the form, and once they click sign up, it opens their phone's camera, and they're asked then to submit 2 forms of ID, either a passport or driver's license or proof of address, and that comes through then in a digital file, which your practice manager and any allocated staff can download that file then. So patients don't need to come into surgery to register anymore, and you can promote that then through the app to say, okay, if you see any patients dropping in prescriptions or filling out at the desk, you can tell patients all about the app. Did they know that they can order now repeats through the app? Okay. The next one now is quite an important development for you guys. This is an admin query. So patients can now request any admin query through the app. They don't have to phone you anymore. So we've done a lot of work with patient participation groups and surgeries all across Wales. We've looked at the call type that coming into you guys. So you guys as receptionists and administrators, you deal with a variety of call types, don't you? We've done an analysis, and about 40% of all calls coming into a GP surgery are admin related. The rest are of clinical nature. So if we could reduce that call volume down, that would make a big difference to you guys. Imagine reducing your call volume by as little as 25%, a quarter of your calls going not coming in anymore and just coming through the app. So it's the patient just can click on here. They can select then whichever title they want. So doctor's letter, sick note, question about a referral, test result, or I need help with something else. Whatever they click on, that will still take them then to your eConsult or Ask My GP portal, but it's the administration section of that portal that it's taken them through to. So if you are on the phone with patients or you're dealing with them at the counter and they're requesting, for example, a continuation paper, you can tell them, yes, we can do it this time, but did you know that next time you can request this through the app? A patient wouldn't need to phone you then. They wouldn't need to listen to your answer phone message. You wouldn't need to sit in a queue before they submit that, and you wouldn't need to upload that onto the system. Once they send it, it goes through to your eConsult, and it's nice and easy. And you've got a full audit trail then. So really try to promote this feature within the app and let patients know about it, because it can make a massive difference then to you guys in practice by reducing your call volume coming in. Okay, the next button is check your symptoms. So for example, if a patient is sitting at home and they want to check their symptoms, they can click this button and it goes to the NHS 111 Wales website where they can search for symptoms. They can either type in what they're looking for or search, and it asks them 4 simple questions, and then at the end of it, it gives out the result, i.e. this is appropriate for GP, or no, go and see your pharmacist, or go to MIU, or go to A&E, whatever it may be. The next then is book appointments. So I know during COVID times we're not allowing patients to book appointments online, are we? But again, some surgeries are allowing patients to book appointments online for chronic disease clinics such as diabetes or asthma. But again, if your practice manager wants to disable this feature, they can just take a tick out of the in their portal, and then that button it disappears. Then the next button then is I want help with my condition. So we've built this. This is all NHS based information. So again, patients can look for symptoms or look for help locally to them, but they look for help of a clinical nature. So again, they can either scroll to look for something, or they can use a keyword search. For example, if I was searching for stop smoking, then it brings up the stop smoking advice in your area, and it links to Help Me Quit. So if I want to find services in my area, I can click on that now, and it's bringing up, hopefully, it takes them through to the Help Me Quit website, which is the Wales National Directory or service for to give up smoking. And then it's recognizing where I am, and it's suggesting then in my area all these pharmacies who now offer the stop smoking service locally to me. And I can search for anything in here. I can go back and I can clear this. And if I typed in vaccination, it brings up all the vaccination schedules. Mums and dads can see when their babies are due, at what intervals. Adults can see, and if they want to click on anything to any more information about any vaccine, then it takes them then to the NHS resource for that. So that's a button, and this is all information for patients of all clinical nature. Again, there's lots of stuff that we've got in here, and patients can look for it, but it's localized to you. It does show services locally to you and to your surgery. The last button then in the home page is community and voluntary services. So patients don't need a prescription for everything and anything they have. A lot of patients can be referred to befriending services, or counselling services, or bereavement services, or mental health services. So this is a directory that obviously nothing's built here yet, but once your practice does start working with the third sector or voluntary sector, those people will have a login, and they will be able then to input information that's on locally to you. So if there's park runs or walking groups or tea mornings or anything that's available for patients in the area, they can find that button, they can click that button then, and they can find out what's going on. Okay, below this then is latest new. There's information about if you've got new doctors starting, or coronavirus updates, or whatever may be the news. There's other links. There's other stuff. Then there's a calendar in here to show patients what's going on. Again, your cluster may put information in here. There's another tab then about information about your surgery. How patients can contact you, your opening times, If you do have branch surgeries, the details do appear here. There's information about out of hours and lots of stuff there. But the thing we'd like you to concentrate on as administrators and receptionists are the things in the homepage. Okay, so again, just to reiterate, your practice manager will be able to enable or disable any of these buttons, but they are face-to-face appointment, clicking there for a clinical query, clicking here to order repeat medication, clicking here for an admin query, which could be very, very beneficial to you guys, clicking there for a symptom checker, clicking there for booking appointment, clicking there to check any symptoms of a clinical nature and localized services to you, and then the voluntary and community and voluntary services, which are voluntary services in your area. So your practice manager will have lots of information on this app. If you'd like more training, then please do ask them, or we can get in touch with you and we can do a one-to-one video training session for you, and how to promote your app to the patient. So I'll just stop sharing my screen now so you can see me again. So your practice manager will have a lot of information about how to tell your patients about it. There are QR codes that you can put on prescription boxes where patients drop off their prescriptions. You can put the sticker off with the QR code with direct app download on your reception counter. You can put it in your consulting rooms with GPs or nurses that they can tell your patients about it. Your practice manager can set a text message. There's social media. They can put a link on the website. There's a pop-up banner, and patients can again scan the QR code, or they can just go to the app stores, Google or Apple, and type in My Surgery app. The app is called My Surgery app. When once they download that, then they get a choice in the app to choose or search for their surgery, and once they favorite their surgery, then they type in your surgery name and say, yes, I'm a patient here. Then that will bring them then to the home page on the app, and they can access then all of the services that you do offer from one place. Because that's one complaint or feedback we did have with some patients is, look, everything's all over the place. Can you put it into one place for us? So the app really is somewhere where the patients can find everything that they want to find in one place. So yeah, it's called My Surgery app. If you'd like any more training, any more information, please do ask your practice manager. But thank you for attending this, and please do promote the app as much as possible to your patients. It really could help you guys to manage your workload better. Okay, thank you.